Who is this man with polydactyly? Name this French professor of urology. Whose hand is this? Fingers on buzzers. The first question, what bony structure lies at the intersection of Kaplan's line and the ulnar border of the ring finger?
I'm not sure, but hook of hamate?
Correct. Well done. 10 points to the challengers. Very good. Okay, your bonuses are on the screen. European cities with links to hand surgery. So this picture is of a European city's old town, which is an inaugural UNESCO World Heritage Site status from 1978. It is home to Europe's largest medieval market and the second oldest university in Central Europe. It also shares its name with a suture tendon repair technique you can confirm with each other. I'll give you a clue, it's not Adelaide.
It's not Adelaide.
No, that one's not in Europe. Go.
Münster?
No, guys, answer the question?
Krakow.
Of course, Krakow, the Krakow School. Okay. But you don't get any points. This is a city in the north of Europe, set on the river Lagan, and is home to the world's largest dry dock. It is famed for its shipbuilding heritage, and it shares the name with flexor tendon rehab protocols. The city hosted the BSSH and German Hand Society meeting in November 2024.
Manchester?
No. Do you know?
No.
It was Belfast, the Belfast flexor tendon regime. Okay, is this picture here? Gamla stan. And it is a very iconic place in Europe, a city in Europe. Do you know the name of the city? It is related to hand-arm vibration in terms of the name of the city. No? Give us a name. I have to, no? Yeah, go on. Anyway, just it's a guess.
Stockholm?
Correct. Stockholm. The Stockholm workshop scales are the classification for hand-arm vibration. What links the people on the screen? Ole.
It was pollution, but that's, I think we know.
Dupuytren's disease. Correct. 10 points. It's a self-portrait. Who is the painter? Who is the painter with polydactyly?
No.
It's not Picasso. No. No.
It's not Picasso. Kandinsky.
No. Okay, you don't know. It's Marc Chagall. It's a self-portrait. It's called a self-portrait with 7 fingers, 1912 to 1913. It refers to the expression, sorry for my pronunciation, mit alle 7 Finger, with all 7 fingers, meaning working as fast and as hard as possible. Okay, you have another bonus attempt. Name the artist of this picture.
Alfred Dürer.
I'll give you that. It's Albrecht Dürer, who's a German painter, and this is called the Hand Study with Bible from 1506 during the Renaissance. So, well done. 5 points for them. Whose artwork is this?
Okay, I know him. He died at age 25 of the flu, of the Great Flu, and
where was he from?
He was. Well, he was. I think he was either from Austria or Germany
or Europe. Okay, I'm not going to give you the points because you're ahead anyway. The artwork is from Egon Schiele, and he was an Austrian expressionist painter. Okay, everybody, fingers on buzzers. Next question. Name this French professor of urology. He was a urologist from the University of Paris. Born in 1831, he was commemorated on a postage stamp in France in 1979 on the occasion of the 18th Congress of the Association of International Urology, held in Paris. He described a space in the wrist through which passed...
Félix Guyon.
Yes, Guillon's canal. Yeah. Which famous surgeon studied sensory function extensively and came up with the concept of two-point discrimination? This was his favorite picture. He called this picture the seeing fingers and was published in his textbook in 1968. What's his name? Don't look at me. Give me an answer.
You could not if you...
I'm not. No. You give me an answer.
Moberg?
Moberg is the answer. Moberg founded the Nordic, which is now the Scandinavian Hand Society. He founded it in 1951. He went on to become the first president of FESSH. This was first published in Moberg, this picture, in Moberg's Swedish textbook, Akut Hand Kirurgi. Okay, next question. Eric Moberg described the advancement flap for thumb defects in 1964. Who modified the flap 4 years later, and what was the modification?
O'Brien is the
Correct.
surgeon. Yeah.
Well done.
And the modification are two little advancement flap at the base of the flap to permit the advancement. To not have here.
So the answer is it was O'Brien, and he incised the proximal part of the flap to allow it to advance better. I give you the points. Well done.
You are so nice.
The Moberg pickup test, the MPUT, is a standardized test to assess for hand dexterity and functional sensibility. It is a test first used in neurorehabilitation to evaluate hand motor activity. It is simple and quick to administer. What equipment is used to undertake the test?
The pickup test is the things for the papers, things.
Paperclip.
Is that your answer?
Paperclip, yeah.
Paper clips, that's wrong. 12 small metallic objects are used and a stopwatch. So you use a stopwatch, a small plastic box, and 12 metal objects. Of which one is a paperclip, but I'm not going to give you any more.
We have one.
No, you're doing very well right now. No.
Give us 1 point.
0 point.
I'm one out of 12.
Okay, fingers on buzzers, guys. Sharing its name with the district of Berlin and a town in Bavaria, and also known as Chiralgia paresthetica, what is the condition and the structure involved? Press.
That's Wartenberg.
Wartenberg. What is the structure involved? In which branch? Okay, this is a picture round. What links these three images?
Kimbo.
Is that your answer?
Yeah.
That's incorrect. It is what links these images. It is.
Kimbok was the answer.
It's the proximal carpal row. You have the lunatum, you have the scaphoid, the boat, and the triquetrum. Okay. All right. Next one. What links these three images? You don't know? Okay. I'll give you a clue. The picture on the left is St. John. Picture in the middle is Duran Duran. And the picture at the end is a German TV presenter, Claudia Kleinert. Yeah, they're all flexor tendon protocols, you understand? But I'm not going to give you the marks. Okay. The last one of the picture round, what links these three pictures? Okay.
Can you give us a clue?
No, that's it. That's fine. You're doing very well right now, so I'm not going to give you it. Okay, the answer is these are parts of the fingertip. We have the lunula, the bronze lunula, we have pulp, which is the rock band, and we have the matrix. So, okay, fingers on buzzers.
You're so mean. You're so mean.
Name this gifted artist. He's a gifted artist. That's his diagrams. And he's a surgeon who worked in Gothenburg, Sweden, and described a pathology first published in the Journal of Bone and Joint Surgery in 1960. Stenner's lesion. Well done. Yes. This is Bertil Stenner. Okay. The bonuses are on anatomical variations. Okay. So the first question is name the accessory muscle found in 12% of the population between ECRL and ECRB and inserting onto the base of the second or third metacarpal.
Supernumerary ECR.
Supernumerary
ECRL, yeah.
Accessory or supernumerary EC.
I've got ECRI, extensor carpi radialis intermedius. Be honest with me. Okay, you're being honest, so that's good. You didn't get that one. Okay, next one. There you go. Okay. Which finger extensor accessory muscle is found in 10% of hands and can be used as a donor for sagittal band reconstruction? Incorrect. The answer is extensor medii proprius. This insertion is typically ulnar to the EDC insertion on the middle finger, as is the usual arrangement of the EIP with respect to the EDC. Okay, last one.
This is the one.
First described by the German-born Dutch anatomist Bernhard Albinus. Manus, correct. Well done.
Yeah, the one.
Name the film. Yes. The Shining. Well done. Do you know whose hand this is?
Jack Nicholson.
Well, guess what? It's not. It's actually Stanley Kubrick's hand because he wanted to do that scene himself. There you go. Name this German surgeon who performed the world's first successful pulmonary artery embolectomy, otherwise known as the Trendelenburg operation. He performed that operation in March 1924.
We're not sure, but just as an easy guess, Trendelenburg?
No. Nice try. No. The answer is, do you want to answer? Kirschner, of Kirschner wires. Martin Kirschner. But you don't get the points. Your next question, your next bonus. With what material did Kirschner make his very first K-wire? Have a guess? No? He used his piano wire from his piano, chrome piano wire. He dipped it to make it hard, and that was his first ever K-wire. What is the official size that a wire becomes a pin? Between what size? So what is the maximum size of a K-wire and the minimum size of a pin?
6
No.
20 millimeters.
No.
3.7?
No, it's 1.5. 1.5, after 1.5, you should not be asking for a 1.6 K-wire, guys, in theaters. 1.6 is a pin. Okay, back to the starters. Yes? What's the answer?
Oh, -5.
-5.
-5.
Which surgeon from the University of Valladolid, who went on to become the president?
Antonia Zapico.
Yeah, well done. So tell us what Antonio Zapico did. Antonia, sorry.
Zapico did the classification of the shape of the lunate.
Yes.
The 1, 2, and 3.
Yes.
Yeah.
Okay, well done. You have the points and you have control of the game.
The name, okay, so you give me more points for this?
No, because it's Spanish. Actually, you should have 1 point because it's a Spanish question. Whose hand is this?
Stalin, I think.
Stalin, no. It's Lenin. There you go. Whose hand is this one?
Rodin.
Rodin is very good pronunciation as well, yes?
Merci.
Okay, merci. Last bonus is whose hand is this? No, don't use Google on your phone. Okay.
You need a sculpture, right?
You know the question. Whose hand is it? This is Franz Liszt in Budapest. This is Emmanuel Kaplan. He went to the USA in 1924 where he practiced as a hand surgeon in New York. He went to medical school actually in Paris, but he was born in 1894 in Kremenchuk, located in which modern-day European country? So where is Kremenchuk located? In which modern-day European country where Kaplan was born?
I try. Ukraine?
Ukraine, well done. Can you name the 4 mechanoreceptors involved in sensibility? Mechanoreceptors. I'll give you a clue. 2 are fast adapting and 2 are slow adapting. This is a typical question in the exams. No, I'm joking. It's not.
So we have Pacini.
Pacini, well done. Yes?
We have Merkel.
Yes?
Golgi.
Yes? Well, okay. Go on. Pacini, Merkel. Pacinian, Merkel. Meissner, yes. One more.
We have 4.
Ruffini.
Pacini, Merkel, Meissner, and...
You said Pacini.
No. One more.
Ruffini is one.
Ruffini.
Yeah, but I'll give you the points. That's good. Well done. Okay. The next question is, what is the active ingredients that stains sweat purple in the sweat test used to assess peripheral nerve injury? So typically we use this for children if they sustain an injury and we want to know whether the autonomic component of the nerve. What is the name of the sweat test? 9-hydrin, correct, but you don't get the points. Yeah, well done. Protective protopathic sensation, which includes temperature, sharp and dull and deep pressure, is mediated by which type of nerve fibers?
Delta?
Correct, well done. Yeah. What are the scores, Julia? What are the scores? So we have 40 for the diplomats so far. And 75 for the professors. Felix Platter of Basel, where we go next year, Switzerland, in 1614 made the first written description of what common hand pathology?
Dupuytren?
Correct.
Yeah.
This is your bonus. Born in the lakeside town of Yverdon-les-Bains, and he was the dean of Lausanne Medical Facility in 1970s, named the Swiss hand surgeon who in 1960 divided the zones of the flexor tendons.
Verdun.
Verdun, correct.
Claude Verdun.
What was the seminal paper that Verdun wrote in April 1960? He compared tendons to the reins of a Roman 4-horse chariot. Quadriga, correct? Complete his famous metaphor. This is Verdun's famous metaphor. A family of 5 brothers.
Paco has a family of 8 brothers.
No, so this is
polydactyly family.
This is Verdun's phrase. A family of 5 brothers, what?
It's a mother and a father, maybe.
No, okay, fine. He said, a family of 5 brothers, of which the thumb is the conductor of the orchestra and the sine qua non of hand function. Okay, that was his, and what he was saying back in those days was these digits are all important, but there is a hierarchy amongst the digits. The thumb is the leader and the conductor of the orchestra, and the sine qua non of hand function. Okay, fingers on buzzers, everybody. This is called classification mathematics. So 2 plus 2 is 4, Wassel 2, Salter is 2 equals? 4. Okay, so are you ready? The question's coming now. Are you ready?
Yeah.
Who's going to get this right? Go. Give me a number, guys.
2.
That's not the answer. So
Is it total?
The total, yes.
you guys can have, you can, no, the answer is not 3. The answer is 5. Sunderland 3, Vegas 2 equals 5. Yeah? Did any of you guys get that right? Everybody, of course. Yeah. What? Which surgeon from Brussels first described the osseous anatomy of the carpus?
Vesalius. But
Correct, Vesalius. Yeah. Andreas Vesalius. What is this? And who does it belong to?
Terminator.
Nice try. Caroline,
Gladiator.
you need to relax a little, Caroline. We need to deal with your social program, Caroline. Okay, guys, what's the answer? Thanos, yes. This is the infinity gauntlet of Thanos from the film. What's the name of the movie? The Avengers: Infinity War. And he used this device to wipe out half of the life in the universe, apparently, with a snap. Name the character of this movie set in 1944 Franco's Spain.
Superman.
Okay, so I'm going to take Superman as your answer. It's not correct. The answer is, this is the pale man from the movie Pan's Labyrinth, 2006.
I said Labyrinth.
No, I'm not giving you.
But I forgot.
You guys are doing well. Come on. You guys are doing okay. Okay, next one.
Not bad.
Okay. It's a little bit steamy for this time of the day, but we thought we would include this picture just to raise the temperature in the room. Name the movie and whose hands are in the picture.
The movie is chocolate.
Can we answer, or do we have to answer?
No, it's your bonus.
Ghost and Patrick Swayze.
French movie.
No?
Ghost is the movie, yeah?
On top, eh?
And
Hands on
whose
top,
whose
eh?
hands are holding whose hands?
Well, it's Patrick Swayze. It's Ghost, and it's Patrick Swayze on the hands of...
Demi Moore.
Well done. You pressed it. You don't. That means if you don't get it right, they get the full question.
Mr. Lonslow would be the answer.
It's not the answer I'm looking for. No, that's it. It's done. So -5 because they were early. So listen carefully. Which country is this painting in?
Vatican.
Well done. Okay. Because normally you would say Italy. Okay. In which European city will you find these hands?
Helsinki.
Well done, Helsinki. Next one. These hands were a temporary installation in which city in 2017?
Venice.
Well done. Okay, next one. In which city? -5 for disruption of the quiz. You know, there's always these surgeons. They just, they don't cooperate. Okay. In which city would you find these hands?
Paris.
No.
Yes.
Antwerp railway station. Okay. Okay, fingers on buzzers, everybody, for the next starter. Name the surgeon who invented some prosthetics and ligatures in amputations. He was regarded as the greatest surgeon of the 16th century. He was a pioneer of surgical treatment of gunshot and other battlefield wounds. He introduced the concept of wound débridement.
Ambroise Paré.
Ambroise Paré. He introduced the concept of wound débridement and phantom limb pain in the 16th century. In his 16th century treatise on surgery, what was his famous phrase?
Je le pansois, Dieu le guarit.
Yes, I dressed the wound and God healed him. Well done. So, okay, so your bonus questions are the music round. You will listen to the music as a group and then answer the question. So, first music, please. When it finishes. Okay, thank you. So, what was that piece of music and why is it special? Okay, you don't know. You don't know? It was Ravel.
They know.
Yeah, it was for Wittgenstein, because he only had one hand after World War II.
There you go. Okay, well done. I'm going to ask the audience to do something maybe, not with the rules. Do you think they should get some points?
No way.
Okay, next piece of music for you guys. Okay, calm down. Okay.
To take life on earth to the second birth, and the man was in command. It was a flight on the wings of a young girl's dreams that flew too far away.
What's the name of the song and who sang it? Who sang
China
it?
in your hands. It's something with hands.
Who
Who sings it?
answer the question clearly, okay?
Pronounce it better.
I don't want this kind of just be clear, be surgical. Yes or no? What's the answer?
Kate Bush. It's not
Kate Bush.
It's not correct, but I needed to say something.
Okay, Kate Bush, and was okay, so it's incorrect. The answer is China in Your Hand, sung by Tapao. Next song.
Hand, touching hands, reaching out, touching me.
Ready, guys? Come on. Ready? Okay, okay. So you know the song is Sweet Caroline, we all know that, and sung by Neil Diamond. What did he do in March 2022 during the COVID pandemic with this song? That's the question.
Okay.
Okay, if you don't know, I will tell you. He changed the chorus to hands, sorry, I can't sing. Hands, washing hands, reaching out, don't touch me, I won't touch you. It was to encourage after the chorus. Okay. Everybody fingers on buzzers. Which French surgeon who popularized the technique of nerve transfer for restoration of elbow flexion after upper brachial plex palsy?
Oberlin, Christophe Oberlin.
Christophe Oberlin, correct.
Yes.
This is an autosomal dominant inherited condition causing calluses on the palm, the soles of the feet, constriction bands, and hearing loss.
It's a syndrome.
It is classically caused by changes in the GJB2 gene. Let's have an answer. Professors of hand surgery.
Go ahead.
Yes, Professor.
Next year you come here.
Very good.
Palmoplantar callosis? No.
I don't know. Is it syndrome?
No, the answer is no. The answer is Vohwinkel's disease or Palmar-keratoderma syndrome. Okay. Can you name the diagnosis and the causative agent?
Orth.
Orth is correct. This is a viral infection caused from sheep and goats caused by the parapox virus in sheep. It's contagious. It's usually solitary. It appears as a small, firm red or reddish-blue lump and enlarges to form a flat-topped, blood-tinged pustule. Okay, treatment may be necessary if a secondary bacterial infection occurs. Which single-stranded RNA virus is most commonly responsible for this?
We haven't answered yet.
Okay, Captain.
It's a consultation.
We can negotiate now.
The answer should
Yes.
be from the captain.
How many minutes do we get to negotiate?
You've got like 5 seconds.
Oh.
Yeah. Okay, the answer is hand, foot, and mouth disease. And this is Coxsackie virus CA16. Abductor digiti minimi, Ankara, Dublin, Moscow. You understand the game? Okay, go. Next slide. Capital cities of the countries. To give the first letter. Slack, well done. Go for the names of the capitals.
Yeah, it's Sofia,
Yeah.
Lisbon, Athens.
Athens.
But then you put Copenhagen on, it's on an island. So next time you put it the right place.
Okay, I'm sorry. 10 points for the answer, 5 points off for attitude. Yeah. Come on. Using the first letter of each flag, name something to do with hand surgery.
Flexor carpi ulnaris.
Correct. So it's Finland, Czech, and Ukraine. So the answer is FCU. Well done. Next one.
Extensor carpi radialis longus.
The flags are for which countries?
That's more difficult.
Estonia, Croatia, Romania, Liechtenstein. Okay, next one. The first flag I'll give you is France. Yeah? Yes.
Okay.
And then Estonia, Spain, Slovakia, Hungary, and that, of course, gives us...
FESSH.
Okay. Which German pioneer of peripheral nerve vascular anatomy, selective neurotomy, and nerve transfer published a book on nerve transfers in 1915? Stoffel, I heard that one first. Who is associated with this building? Okay, the answer is Dupuytren. Dupuytren statues there. Okay, next bonus. This is the Hotel Dieu de Lyon. What famous? Okay, this is Ollier's disease is related to this. Okay? And this is Glasgow Royal Infirmary. Who is the famous person associated with Glasgow Royal Infirmary?
Kaplan's Carolines?
Lord Lister. He's the one who
Lister.
did antisepsis.
Right?
Well, did they get help? I don't know. That's the chairman of examiners. I mean.
I'm not talking about him.
Next question, guys. Roughly how many years apart were the descriptions of a Swedish anatomist and a Bohemian anatomist who gave their names to a link between the median and ulnar nerve in the distal forearm? No. Okay, no one get it? The answer is 100 years because Roland Martin of Uppsala described Martin Gruber in 1763 and Wenzel Leopold Gruber described it in 1870. So it's 100 years between the two of them, and then we get now the Martin Gruber anastomosis. Interesting, right? Name the father of pediatric orthopedics in Finland who developed the procedure to correct premature fusion of growth plates.
Simon Wilkie.
Incorrect. He's interrupted. -5. What? Name the now you can have the full question. Take your time. Name the father of pediatric orthopedics in Finland who developed the procedure to correct premature fusion of growth plates in children, and he also classified Blount's disease. He was a prominent Finnish orthopedic surgeon and professor of orthopedics and traumatology at the University of Helsinki. He made significant contributions to the field, especially the study of the physis in particular and Blount's disease. Okay, that's it though, you've timed out. The answer is Andreas Fabian Langeskoild, 1960 to 2000. Okay, fingers on buzzers for the next starter. Name this surgeon who was born in Kraslice in Czechoslovakia and graduated from the University of Vienna in 1902. He is well known. Steindler is the correct answer. He is well known for his development technique for post-poliomyelitis or brachial plexus palsy flail elbow. And what he did was describe the transportation of the flexor origin proximally to restore elbow flexion. He moved to the United States in 1907 to work in the Chicago Hospital for Crippled Children. His classic book, Mechanics of Normal and Pathological Locomotion in Man, was published in 1935 and developed the field of orthopedic biomechanics and motion analysis. That's Arthur Steindler, 1878 to 1959. Okay. Oh, well done, guys. The winners today who are taking selfies with a score. So the challengers, the diplomats, have a score of 75. And our respected professors and leaders of the world of hand surgery have a score of 145.